Now, the first red flags following the detection of the COVID-19 Omicron variant have begun to emerge in Tshwane. According to the NICD, toddlers under the age of 2 account for about 10% of all hospital admissions in that city. The institute says very small children would not be protected by vaccines as they are not able to get shots yet. Professor Jeane, Cloete, a paediatrician at the Biko Academic Hospital, joins me now live from Pretoria. Very good morning to you, Professor Cloete. Some really concerning revelations when it comes to the latest reports. I mean, children are now the latest victims.
Good morning, Mpo. Good morning to all your viewers, and thank you for having me. Yes, we have seen an increased admission number of children admitted at Tshwane at the moment. However, it's difficult to ascertain if it is just due to the increased numbers that we're having in general in our population, or if it is just an increase in numbers in the pediatric population from what we saw before. What I can tell you and what I can confirm is that from the 14th of November, we had a massive increase in our positivity rate amongst children. But it's important to know that some children are admitted with COVID as an incidental finding, not necessarily with symptomatic COVID, and some children are admitted with symptomatic COVID. So we need to differentiate between that as one of the possible causes why we're seeing this increase.
And as you see the increase, what are some of the underlying linking symptoms that you're observing?
Currently, most children present still with fever, a cough. Some children do present with vomiting and diarrhea, as that is part of the symptomology we often see in children. And that is by far the predominant symptoms, and that's consistent with what we have seen in the previous waves. So the symptomology hasn't really changed much.
Is there a cause for concern? I mean, we are dealing with a different variant. Still lots of questions about, how that will affect the overall population, what it means for those who are vaccinated and, with children in their households and interacting with them on a day-to-day.
Well, I think it's very early for us to postulate if we should be concerned. The current rise in admissions in Tshwane, of the patients we admitted, more than a half of them actually were incidental COVID findings. So they were asymptomatic children that were admitted for a surgical procedure or that had a fracture of their arm and they needed to come into hospital to have that sorted out. Only less than half of our patients had symptomatic COVID. And so at the moment, I don't think there's a cause for alarm. I don't think we have enough information to definitively say how the new strain will affect this particular population. I think it's too early for us to really know. However, we are actively monitoring the situation to see how trends will arise over time.
As we speak, the Basic Education Department is really accelerating their drive to ensure that those between the ages of 12 and 17 are vaccinated, making schools the place to go. When it comes to very young children and their immune system, I mean, what do we know when it comes to their immune system? And, of course, they cannot be vaccinated for COVID-19 as yet.
Absolutely. The younger children, the infants normally younger than 1 year of age, we know they have an increased risk to get symptomatic COVID and they've got an increased risk to get more severe COVID. This was consistent in our third wave as well as in our second wave. I think the message should be that our population should be vaccinating to prevent our vulnerable part of our population to get COVID. Infants less than 1 year of age they are not part of the vaccine population. So I think that us as a population, we should be vaccinating to prevent other people that cannot vaccinate to get COVID and to get severe COVID.
Very well. We're going to have to leave it there for now. Thank you so much for your time. In conversation there with Professor Jeane Cloete from the Steve Biko Academic Hospital. She is a pediatrician, giving us the latest on some of the figures that we're learning of with this new Omicron variant in Tshwane. Over 50 are toddlers. Of the 500 hospitalized are toddlers.